So epilepsy is a neurological condition characterized by abnormal circuitry within the brain that causes recurrent seizures. There can sometimes be a genetic basis to it, other times it can be sporadic or secondary after certain events such as trauma. Epilepsy can be secondary to a lesion or a structural abnormality within the brain, while other cases sometimes do not involve any structural abnormality at all. Epilepsy is quite common in the population and affects about 1 in 100 people, or about 3 million people nationwide. Common treatment options for epilepsy involve medications as well as dietary alterations. And when medications fail or a patient fails 2 to 3 anti-seizure medications, that's when surgical options are typically discussed. For patients with seizures, decisions on surgical candidacy are typically made after a number of tests are ordered. These tests include MRI of the brain, video EEG monitoring, as well as neuropsychological testing and other non-invasive tests such as PET scanning. In instances where those tests are able to accurately identify where the seizure is coming from, there are several surgical options that are available. In instances where those non-invasive tests are not able to identify where seizures are coming from, a phase 2 study may be indicated. A phase 2 study consists of placing wires deep within the brain through small incisions to help record the electrical activity of the brain and to identify the location of seizures prior to offering any of the surgical options. The surgical options that are available for epilepsy are as follows. Resection is the most common option. This involves removing a portion of diseased brain that's causing seizures in hopes of curing the epilepsy. There's a newer technique available that's minimally invasive that involves using a special laser to, instead of resect the tissue, to burn it using thermal energy. This is called laser ablation. In instances where the diseased tissue cannot be safely removed because of its location near important vital functioning structures in the brain, such as parts of the brain involved in movement or speech, there are a number of different options that involve electrical stimulation or neuromodulation. Responsive neurostimulation, or RNS, is basically a pacemaker of the brain. Wires are placed either on the brain or in the brain, which are capable of detecting seizure activity. When seizure activity is detected, these wires then deliver a small amount of electricity to that area to hopefully abort the seizure. This therapy is typically reserved in patients that have seizures coming from multiple areas or in patients that have seizures coming from eloquent areas of the brain that subserve vital functions such as movement or speech. Deep brain stimulation is another option that involves placing wires deep within the brain, within the thalamus. This is reserved for instances of more diffuse epilepsy or epilepsy coming from multiple lobes of the brain. The final option is vagal nerve stimulation, which is reserved for cases of diffuse epilepsy or in instances where the seizure focus cannot be properly identified. This involves placing a stimulating wire on the vagus nerve within the neck to deliver small doses of electrical activity to the nerve in hopes of reducing seizure activity.